Welcome to my channel. Please subscribe, like, share and press the bell icon to stay connected and notified. Thank you. Welcome to part 5 cervical spondylosis series. Cervical spondylosis is a condition where an abnormality is seen in one or more disc intervertebral discs, as this is because of wear and tear as we grow old. As this is mostly age related, most people get affected and may or may not show symptoms. As we have seen in the last video, treatment is mostly conservative and non-surgical. Without any doubt, physiotherapeutic treatment has done wonders in recovering from cervical spondylosis back to normal range of motion. So most commonly we see that patients who recovered from the cervical spondylosis tend to forget or ignore to take precautions in their routine work, and which may lead to recurrence of cervical spondylosis back again, and this time it can be more worse. In this particular video we'll explore the do's and don'ts of cervical spondylosis. So let's begin the video. Let's talk about the do's. Do turn to one side and transfer body weight on hands and get up slowly while simultaneously move lower limb out of the bed. Do it in a way as shown in the video. Do this another variant and whichever you feel easy and comfortable. Do use the cervical brace or cervical collar during the daytime, especially while you are driving or riding and at your work. Do use the cervical pillow during night time. You can use the cervical pillow during night time and this one during travel. Do take small breaks in between the work, driving, riding, studying, etc. Do correct your workstation. As you can see in the picture here, the height of the chair should be adjusted to around 16 to 20 inches depending on your height, and the height of the table should be around 25 to 30 inches based on your height, and the distance from the eye to the computer screen should be 18 to 24 inches. If all these dimensions are according to this based on your height, then your angles at your joints will fall at 90 degree at the elbow, 90 degrees should be 90 degrees at the hip joint, and should be 90 degrees at the knee joint, 90 degrees it should be at the ankle joint. That also you also should take care of the shoulders should be relaxed, and the back support, proper back support, and there should be arm support. A thigh should be horizontal and the feet should rest flat on the floor. So this is the appropriate and the correct posture sitting at the workstation, and you should adjust your workstation, your table and chair at this particular height based on your height, so that the joints should fall an angle of 90 degrees at the hip, knee and ankle, and elbow should properly rest on the support of the chair, armrest, and the wrist should support, they should be there on the table properly. So this is how the workstation should be. Do use a smartphone or tab in a proper manner. Upright posture is suggested always when you use your tab or the smartphone while standing or sitting in this way. Do maintain the proper upright position and proper arm swing while walking. Do check for bike shock absorbers very often and use a smooth roads to avoid sudden jerks on your neck. Do practice cervical spondylosis exercises and stretches at home to strengthen and loosen up the stiff neck muscles. Do use a hot packs or TENS unit if you feel pain. Do take high fiber content diet like vegetables, fruits containing zinc, omega-3 fatty acids to have better healing or relief from neck pain. Do drink lots of water, as staying hydrated is very important to all parts of our body, including our intervertebral discs. Do visit the physiotherapist in case you feel unbearable pain or stiffness, and also for regular checkup. Let's talk about the don'ts. Don't get up from the bed from supine position, that is lying on your back, straight away from the back. It will be strenuous to the neck. And don't use very high or too many pillows. You can see over here how the high pillow, using of high pillow or too many pillows, how it will affect your spine. And even if you use a low pillow also, or very thin pillow also, you can see the effect on the spine. And this is a correct, appropriate, and always it is recommended to use the cervical pillow. Don't roll your neck, as it will grind your neck bones together. Don't sleep on your stomachs, as it will worsen the pain and can develop cramps as well. Don't lift and carry heavy weights, especially on shoulders. Don't use smartphone or tab in this manner. Don't try any hardcore massages, since it will only worsen the neck condition. Don't use neck collars for too long, and don't get exposed to cold and cold bath. Keep your neck warm and covered during the cold. Don't consume citrus fruits, egg, tomato, potato, since they can precipitate pain. Don't go for any random spondylosis treatment at cheaper price. And do consult qualified registered physiotherapist only. End of the cervical spondylosis series. Thank you.